Good afternoon. Thank you again for joining us today. As usual, I will give today's statistics first. The total number of positive cases reported yesterday was 1,261. That represents 6.5% of the total number of tests that were carried out and takes the total number of confirmed cases in Scotland now to 76,448. 488 of the new cases were in Greater Glasgow and Clyde, 272 in Lanarkshire, 145 in Lothian and 80 in Ayrshire and Arran. The remaining 276 cases were spread across 8 other health board areas. I can also confirm that 1,235 people are currently in hospital. That's a decrease of 4 from yesterday, and 93 people are in intensive care, which is 9 fewer than yesterday. Finally, though, I very much regret to say that an additional 64 deaths have been registered in the past 24 hours of a patient who first tested positive over the previous 28 days. That's the highest daily total of deaths since the 6th of May, and it takes the total number of deaths under this daily measurement to 3,143. National Records of Scotland has also just published its weekly update, which you will recall includes cases where COVID is a suspected or contributory cause of death, in addition to those that are confirmed through a test. Today's update shows that by Sunday just past, the total number of registered deaths linked to COVID under that wider definition was 4,856. 206 of those were registered last week, which is 28 more than in the week before. 143 of last week's COVID deaths were in hospital, 53 in care homes, 1 in another institutional setting, and 9 at home or in a non-institutional setting. These deaths, of course, and I think today in particular, it's important to remember this, these are not statistics and none of us should ever see them in that way. Every single one of the numbers I report here on a daily basis represents an individual who was loved, unique, and for many people irreplaceable. So I want again to send my condolences to all those who have lost a loved one during this pandemic. Now, before I move on to the main subjects of today's briefing, let me just say a few words about Remembrance Day. Like many people across Scotland, I stood in silence at 11 o'clock today to pay tribute to those who died in World War I and in subsequent conflicts. We mustn't ever lose sight of the sacrifices that they made, and although this year's Remembrance commemorations have by necessity been different from those that we are used to, and I'm sure many people have found that very difficult, they have nevertheless allowed people across the country to pay our respects in a range of different ways. So I want to take the opportunity today to thank everyone who has been involved in this year's events and everyone who has taken part in them. I'm joined by Jason Leitch today, who will say a word or two in a moment, underlining the advice that we are giving. But first of all, can I highlight a few points? Firstly, let me point out that the Higher Education Minister, Richard Lochhead, will give a statement to Parliament later today about COVID and students. I'm not going to preempt that statement right now, but it will include details of the arrangements that we're putting in place for students to get tested before they return home for Christmas, if indeed that is what they wish to do. Not all students will be in a position to do that. And it will also set out our current plans more generally for handling the Christmas holiday period. So I'm sure it will be of great interest to quite a few of you if you are watching and you are a student, or if you have a student in your family. There are 3 other substantive points that I want to briefly update on today. Firstly, I'll quickly summarise the key points that I made in the statement I gave to Parliament yesterday. The first one is particularly important to stress, I think, given today's figures. Although it may not seem like it, and when you hear figures such as the one I've reported today for the number of people dying, I'm sure it doesn't feel like it. But the fact is, the measures that we have adopted in recent weeks and the sacrifices all of you and people across the country have been making have been having an effect. There's no doubt when we look at the data over the past few weeks that these measures have slowed very significantly the rate at which cases were increasing. And that is really good news. As I said yesterday, if the rate of increase in new cases that we had seen at the end of September into the early part of October had continued, we would now be reporting somewhere in the region of 3,000 cases every day. Clearly, as you can see, that is not the case. So everybody should be under no doubt that these measures and these sacrifices have had an effect, and they will have saved lives. That said, and I said this yesterday in Parliament as well, we cannot yet be sure that we are seeing a significant and sustained fall in the number of cases. We are certainly seeing a flattening off, and in some areas we've seen signs of a reduction, but we need to see cases come down overall, because I've set out before why it would not be a good position to go into the depths of winter with cases at the level they are at just now, even if that level is quite stable. So it's for that reason we adopted a very cautious approach yesterday when we carried out the first review of the allocation of levels of restriction to different local authority areas. Only 2 substantive changes were made, although they are big changes, and each of them affects 3 local authority areas, although different local authority areas. First of all, from Friday, and this reflects the very low number of cases on the islands. People in Orkney, Shetland and the Western Isles will be able to meet in each other's homes, something that the rest of us have not been able to do, are still not able to do, and nobody in Scotland has been able to do for some time. There will be limits, of course. No more than 6 people can meet from no more than 2 households. And this is an important point. People who are going to or returning to the islands after being on the mainland should not mix in other people's houses for a period after they return, and we will issue some guidance on that latter point later in the week. Unfortunately, household meetings are not yet allowed in the 2 other Level 1 local authority areas, Moray and Highland, except for essential purposes like providing care. But the case numbers in these areas, although relatively low compared to other parts of Scotland, have been volatile and seen a slight increase in recent days, so we want to be very cautious before easing restrictions there. The second change I announced yesterday is that Fife, Angus and Perth and Kinross will from Friday move from Level 2 to Level 3. That change wasn't made lightly, but it reflects the fact that case numbers in all 3 of these areas have been increasing really quite sharply in recent days, and we believe that the best way of handling that increase is to introduce tighter restrictions now to try to get it under control before the situation deteriorates any further. And hopefully this move to Level 3 will have an impact, and Fife, Angus and Perth and Kinross will be able to return to Level 2 before too long. There are several other local authority areas that we're paying very close attention to. For example, for those currently in Level 3, there are several areas, particularly in the west of Scotland, where either the increase in cases has stabilised but at a stubbornly high level, or where numbers are currently rising at a rate that is causing us concern. So we've concluded that it is not necessary at this stage to move any of these areas into Level 4, but clearly that's an option we cannot rule out, and we'll be monitoring these areas very closely in the days ahead. There are also, of course, some areas at Level 3 which we hope will be able to move down into Level 2 in the not too distant future, and indeed some areas in Level 2 that we hope in the not too distant future will be able to move down into Level 1, but that will only be possible if progress continues. So basically what that means for all parts of Scotland, whatever level you are living in, the basic message remains the same. The best way of avoiding the need for tighter restrictions and hopefully of moving to a lower level of restrictions in the future is to stick to the current rules and guidelines. That's how all of us can help to break the chains of transmission and get the virus back under control. If you're in any doubt at all about the position in your local area, please go to the COVID section of the Scottish Government's website. You can enter your postcode and find out what level your area is in and what that means for you practically, and that will help you ensure that you're sticking to all the rules and guidance. Now, the second issue I want to touch on very briefly relates to preparations for winter, more widely than COVID. We've discussed some of this at previous briefings, the steps we are taking to ensure that the health service is ready to cope with the wider pressures of winter. But we are also considering the wider support and help that people might need. So we have updated the Ready Scotland website, ready.scot, to provide advice on how to prepare for winter and to give information to anyone who might need support. I'll read out a helpline number in a moment that you might want to take a note of. The Ready Scotland website also provides guidance for people who don't need help themselves, but who want to assist others, maybe offering help to a neighbour or other vulnerable people in your community. Throughout the pandemic, we've seen that solidarity and a sense of community spirit plays an important role and has played an important role in getting us through these past months. So that sense of kindness and solidarity will also be really important during the winter period. Support networks will be especially important to people at risk, to older and disabled people, or to those who are on their own and will be feeling lonely. So if you want to find out more about helping others, or if you think you might need some support yourself, you can go to the ready.scot website. Alternatively, you can call the assistance hotline. The number is 0800 111 4000. That is 0800 111 4000. Now, the final issue I want to highlight is that tomorrow marks the start of Diwali. I'm very aware that the next 5 days, Saturday in particular, are a time of great significance for Scotland's Hindu, Sikh, Buddhist and Jain communities. This will be, though, a very different Diwali from the ones that you're used to. Communities won't be able to come together as they normally would. You won't be able to host people in your home or visit friends and family as you would usually do. You'll need to celebrate in a different way, perhaps by using technology or within guidelines by visiting your place of worship. I know how difficult that will be, and given that we talk a lot about Christmas, but perhaps talk less about these other celebrations that are very important to other faith communities across the country, it's important to recognise the difficulty that many are facing at this time. But to everybody who is celebrating Diwali, I hope you have a very special time, even in these tough circumstances. And I hope you know that over the next few days you will be in my thoughts, and I'm sure in the thoughts of many across the country. And thank you for celebrating in a way that keeps you safe, your loved ones safe, and the NHS and wider community too. Before I finish, because that concludes the main issues I wanted to update you on today, let me just remind you of all of the things that we're asking you to do right now, and remind you how important it is that everybody sticks to these things if we are going to, over the next few weeks, see a situation of continuing progress as opposed to deterioration in the spread of the virus. There's no doubt that sticking to these rules gives all of us the best chance of avoiding tougher restrictions and hopefully moving to a greater degree of normality. So if you're living in one of the areas at level 3, please don't travel outside your own local authority area except for essential purposes. You can find out what we mean by that on the website, but it includes work that you can't do at home, caring responsibilities or childcare. Level 3, remember, covers virtually all of the Central Belt and Dundee, and as of Friday will include Fife, Angus and Perth and Kinross. People in other parts of Scotland should not travel to level 3 areas except for the same essential purposes. And please don't travel outside of Scotland just now unless you really have to. Don't travel to other parts of the UK or overseas unless it is essential. In addition, nobody from Friday outside of Orkney, Shetland and the Western Isles should be visiting each other's homes just now, again, except for the very specific purposes like caring for a vulnerable person, childcare, or if you're part of an extended household. When you do meet other households outdoors or in indoor public places or in the islands from Friday in your own home, remember it's a maximum of 6 people from a maximum of 2 households. Avoid car sharing if you can, work from home if you can, and download the Protect Scotland app. Finally, please remember the facts rules which help to keep everybody safe. Face coverings, avoid places with crowded people, clean your hands in hard surfaces, keep a 2-metre distance from people in other households, and finally, self-isolate and get tested if you have any of the symptoms of COVID. These things are all tough to do and to remember each and every day, but they are making a difference, and they will continue to make the difference between us getting control and keeping control of this virus or the situation deteriorating and running out of control again. So thank you to all of you for everything you're doing, and thank you for joining us and listening today. I'll hand over briefly to Jason to say a few words before we take questions as usual.
Thank you, First Minister. I'm just going to emphasise some of the stats and data that we've heard in the last few days as we move to the first review of this new regional tier system. I want to take you back slightly artificially to exactly 2 months ago. So this is the 11th of November. On the 11th of September, we announced 175 new cases. Today we announced 1,261 new cases. On the 11th of September, we had 45 people in hospital. Today we have 1,235 in hospital. On the 11th of September, we had 6 people in intensive care. Today we have 93 people in intensive care. And on the 11th of September, we reported no registered deaths in the previous 24 hours. Today we announced 64. I used the date slightly artificially to illustrate that these numbers today are not normal. It is not the time to take our foot off the brakes. It is the time, I'm afraid, to be restrictive. And that's why we can't go into each other's homes. It's why some places have gone up and very few places have had any release of the restrictions. I, the First Minister, you, everybody wants this to go down, but it cannot go down when the numbers are this high. 5,500 people died of this disease yesterday around the world, and there were 350,000 new infections across Europe. There's been quite a lot of dialogue and intervention around why three local authorities went from 2 to 3. It's a complex decision-making process. It's a complex set of advice. And the individual numbers are difficult to read across and then say, yes, you should be a 2, you should be a 3. One of the things we look at, though, is acceleration and trends in the data. And it's just one single data point, but let me just illustrate it with this before handing back to the First Minister. Angus has gone up 47% in 7 days. Fife has gone up 40% in 7 days. And Perth and Kinross has gone up 32% in 7 days. Now, that doesn't mean that's what you would always do to a local authority, or if they reverse that, it will always come down. It's not as simple as that. But the pandemic is accelerating in those 3 local authorities. It therefore needs level 3 restrictions to slow it down. First Minister.
Thanks, Jason. I'll move now straight to questions. First question today is from Lisa Summers from the BBC.
First Minister, a question on testing. Yesterday, the UK Health Secretary announced that mass testing would be available to 67 parts of England. He said the technology would be also available to the devolved nations. So when and where are we going to see that here, given it could make a difference to what level we find ourselves living in? And he also said that routine testing would start for NHS staff. That's something that we've heard health workers call for a long time here. So when is that going to start in Scotland? Are we falling behind other parts of the UK? And separately, can I ask a question about teachers in Aberdeen, because they've been told to switch off the contact tracing app while they're in schools because of concerns that they will have some problems chasing genuine contacts. So are these teachers unable to find out just exactly how exposed to the virus that they've been? Does it demonstrate a flaw with the contact tracing app?
No, I don't think it demonstrates a flaw. I'll come back to that in a moment. On testing, no, we're not falling behind. I covered some of this in Parliament yesterday. The Higher Education Minister will set out today how we will use what are called lateral flow devices, which we have a stock of, to help test the student population before they return home for Christmas. There is also a debate actually in Parliament this afternoon that looks at mass or routine, whatever term you want to use, testing of health and care workers using this kind of testing, which is what has been announced down south. We are currently working through the logistics of that. And we're also looking at where we could use this new technology in a way that is targeted, where we have outbreaks or areas of higher prevalence. I think one of the things that has been shown time and again over the past 8 months is that announcing that you're doing something on testing is one thing, actually making sure you have worked through the logistics and the practicalities, and that you understand exactly what you're trying to achieve with the use of testing in a particular area is often the harder bit, and that's what we are trying to do methodically. Jason might want to say a word about this. I think lateral flow devices, and in short, they are tests, unlike our PCR tests, that take a little bit of time. You know, it's quite an invasive test. It goes to a lab. It takes a bit of time for you to get your results back. These tests are more akin to, I think, a pregnancy test. They are quicker and therefore they have a flexibility that PCR testing doesn't have. But, and this is an important but, they are not as accurate, and they are not as specific in terms of what they do. So we have to think about how we use them. The other thing which is true of any testing, and it's quite a difficult thing because I think we all want to see testing as one of the magic solutions, and it is hugely important. I'm not saying it's not, but a test is a point in time answer to whether at that point in time you have COVID or not, or, you know, even more limited than that, whether you are shedding the virus that allows a test to pick up that you have COVID. So it's important that we use testing properly, effectively, that we think through all of the logistics of how we're going to do things, not just announce them in a blaze of glory, but that we also help people to understand that testing is not necessarily a panacea to everything else around the management of this virus. So we're trying to do this carefully, methodically, and in a way where we can follow through on these commitments that we make. But you'll hear more on how we intend to use these different types of tests more and in what populations over the next period. In terms of Aberdeen, so I don't have all of the details here. I understand, and as I say, I don't have all of the details, so if my understanding is wrong in any way, that I apologise for that in advance. But I understand there may have been an incident in a school in Aberdeen where a number of phones, perhaps, I don't know, in people's bags, where phones were all together, but the people who the phones belonged to weren't all together, and therefore they all got pinged. But that's not a flaw. That's about, if you are not with your phone, then clearly, switching off the app if you want to is not something that causes a problem. But we shouldn't be asking people to switch off the app, in my view, when they have their phone with them. That's defeating the purpose of Protect Scotland. In fact, I would say, Jason might want to say a bit more about this from the public health perspective, we should be encouraging people, unless they do a job where this clearly wouldn't be appropriate, to keep their phones on them with the app switched on so that Protect Scotland is working the way it should. So I'm very clear about that. And obviously, as we get more information, or if there's more information that I'm not currently aware of about what exactly the situation is in Aberdeen, I'll be happy to expand on that later.
So briefly in reverse order, yes, carry your phone with you. Don't switch the app off unless you're wearing PPE and in contact with people, patients, families that would protect you from. So if you're a dentist and you're treating people in the dental surgery, your app would be off perfectly appropriately because you are protected. But if you go for coffee with the staff, your app should be back on. So it's very straightforward, and that shouldn't happen in schools except in very exceptional circumstances where they're perhaps having to treat somebody who's sick. As for the testing, we've always said that one of the ways out of this is rapid testing, along with vaccination and therapeutics. And the lateral flow testing and the LAMP testing and all the other technologies that are coming are very, very encouraging, and we should engage with them and we should use them for what they're good for, and we should do that quickly. But we shouldn't expect them to solve all our problems. There are two categories for every test in the world, whether it's a mammogram, a pregnancy test, a blood test for iron, or an infectious disease test. And that's specificity. So does it find just this bug? Or does it find all viruses? Or does it get mixed up with bacteria and viruses? So the specificity of the LAMP testing is good. So when it finds it, it finds it. The sensitivity is the second category, and that's how well does it find it? So does it miss people? And unfortunately, the sensitivity for this is poorer, much, much poorer than the PCR testing, which is high 90s. This LAMP testing, somewhere between 50 and 60%, but improving all the time. Three elements: the machine, the reagents, the chemicals, and the swab. And you need to get all of them right, and they're all developing all the time. That doesn't mean it's not useful, but it just means you have to use it for the right thing. One of the ways of getting over the sensitivity problem is do it more often. So test twice weekly, or test twice a fortnight, or that would be weekly, or whatever it is you think will make up for that sensitivity. And that's all being considered about NHS workers, about students, about every other high-risk category you can possibly think of. And we will implement it just as soon as we think it's the right thing to do.
Can I make one final point, which is a bit off topic? It's not off the COVID topic, but it's off the testing topic. But it actually relates to something else I was reading on the BBC earlier on this morning. It is absolutely right, and let me just preface this comment by saying that Scotland, there's scrutiny over how Scotland is doing in all matters COVID, not just in our own terms, but in relation to other countries, whether that's across the UK, Europe or the world. So that is legitimate and appropriate. I'm not saying it's not. But sometimes, this temptation to say Scotland is falling behind on something, when in actual fact what it might mean is that we're trying to do things in a proper way. The story I read earlier on the BBC was about long COVID. And the headline of this story this morning is that England's investing £10 million in specialist clinics and Scotland is not. In actual fact, £10 million being spent in England in a Scottish context would be 800,000 or something. You're not going to get many specialist clinics for £800,000. But in actual fact, what Scotland is doing is we've invested £5 million in, I think, 56 rapid research projects into long COVID, because we need to do the work to understand long COVID better before we can set up specialist clinics, because we need to understand it before we know what specialisms are required to properly treat it. So I'm briefly referring to that because sometimes Scotland's not doing what England is doing just maybe means we're doing it in a different way. And sometimes, not always, that might mean we're doing it in a better and more methodical way. So I make that point just as a general point about comparisons, their legitimacy and sometimes their ability to mislead as well. Lisa Summers is the question I've just taken, so I will now go to Colin White from STV.
Thank you very much, First Minister. Still on testing, you've always said that Test and Protect was working well, but the latest statistics from Public Health Scotland refer to a coding error where the numbers were overestimated for if they tested positive and were contacted within 24 hours. Is the system robust enough? Are the figures robust enough for the public to have health in them now?
Yes, and I'll actually take you through the most up-to-date statistics, and I'm going to refer to statistics which are actually published today by Public Health Scotland. But firstly, let me acknowledge there has been a coding error going back in terms of how Public Health Scotland have been classifying cases, and without going into all the technical details from it, it means that some of the cases that they had classified as being processed within 0 to 24 hours actually should have fallen within the 24 to 48 hours. And that has changed some of the figures. And Public Health Scotland actually published this on their website and updated the figures on Friday. But Test and Protect is working well, and the figures that are published today will demonstrate that. So let me quote firstly what the World Health Organization says is the target that should be achieved, and I'm going to quote it precisely. It says that at least 80% of new cases should have their close contacts traced and in quarantine within 72 hours of case confirmation. So 80% within 72 hours. The figures that will be published by Public Health Scotland today show that in the most recent week, up to the 8th of November, 95.8% of the contact tracing of all positive cases was completed within 72 hours. So not 80%, 95.8%. In fact, 88.7% was completed within 48 hours. So Test and Protect was exceeding the WHO standard for 72 hours within 48 hours. And just for completeness, 60.5% completed within 24 hours. And in the previous week, those figures were similar. So I'm not just quoting 1 week. So Test and Protect is working well. And that part of the journey that I have just talked about there is from the point that somebody is confirmed as testing positive. That's the bit that Test and Protect is in complete control over. There is another measurement which takes from the point the test is taken to the person testing positive having their contact tracing interview done. Test and Protect is not entirely in control of that whole process because we are dependent on the turnaround time of the test, which you've heard me say before, we work closely with the UK government to try to ensure is as quickly as possible. But in the most recent week, even looking at that that journey from swab being taken, 91% of positive cases had their contact tracing interview completed within 72 hours of their test. More than 2/3 had it done within 48 hours of the test being taken. So Test and Protect is working well. Like any system, it is not going to be perfect. The coding error should not have happened, but it happened. These things do happen in computer systems sometimes. It's been rectified, but the figures that have been published today or are being published today demonstrate that Test and Protect is working to a very high standard. There's no complacency in that. We've got to continue to make sure that that remains the case. Tim Backshaw from ITV Border.
Thank you, First Minister. I appreciate you can't say too much about students before this afternoon's announcement, but can you tell us in general terms what measures have been taken to ensure a four-nation approach in this, so there's no possible confusion between students who come from other parts of the UK, English students who are in Scotland and vice versa? And also, are you able to clarify whether the testing will be available to all students or will it be mainly targeted at those in the halls of residence?
Well, I'm not going to preempt, because I can and shouldn't preempt a parliamentary statement, or the presiding officer will take a dim view of that. There has been a four nations approach, so I think broadly speaking, the approach that will be taken in Scotland will be similar to the one taken in England. Very often, ITV Borders questions to me are predicated on the fact that people can't understand which part of the UK they live in. I know it's really important to try to avoid confusion, but I actually think people are capable of understanding if they are in Scotland or if they're studying in Scotland. It's the arrangements in Scotland that apply. But you're right to say that with the movement of students across different parts of the UK, a four nations approach is particularly important in that respect, and there has been a lot of work undertaken to ensure that. I'll leave the Higher Education Minister to set out the detail. Obviously, the priority here are students who are likely to be travelling from a university accommodation to their parents' or family accommodation. So if you commute to university every day, if you're still living at home and commute every day, that's clearly not the same as somebody who's been living in halls of residence and might want to go home for Christmas. So the priority will be people who are likely to be effectively migrating to different addresses for the Christmas period, and we want to make sure that anybody in that category gets access to testing. It will be really important, going back to the comments Jason and I both made in response to Lisa's question earlier on, it will be really important for us to try to make sure students understand what a test tells them and what it doesn't tell them. So a test will tell you that on the day you take the test hasn't identified that you, if you're negative, of course, that it hasn't identified that you have COVID. It doesn't mean that if you took the same test a week later, you would still not have COVID. So if you get a test and you're negative, then students will have to be very careful then about making sure they don't expose themselves to the virus between the test and going home. And of course, if the student tests positive, all of the important advice around self-isolation will be critical that students understand. So this is an important tool in our toolbox to ensure that students can go home for Christmas, which everybody wants if that's what they want to do, but that happens safely. But it's not the only thing. Testing is important, but the day we see testing as some kind of magic panacea that means we don't have to comply with all of the other restrictions is the day I think we make quite a significant mistake.
Only a sense it's even worse than that, because if you test negative, you may be incubating the virus. So when you go home with your negative test, you could still take the virus with you, whoever you are, whether you're a student, whether you're a care home visitor, whatever you are. So you have to follow the restrictions, the distancing, all the other advice that we're going to have to put in place around those household visits and everything else that goes along with them. You cannot find incubating virus with these tests.
Phil McDonald from Global.
Thanks very much, First Minister. Just following the review of the levels system yesterday, the leader of Aberdeen City Council said they should have been moved down into Tier 1 because they have the exact same indicators as the Highlands, which is, of course, in Level 1. So what's keeping Aberdeen in Tier 2 when the evidence suggests that it could move down to Tier 1?
I set this out as clearly as possible in the statement yesterday. I don't have all of the local authority data sheets in front of me right now, but you can go onto the Scottish Government website and see them. So Aberdeen, and I did make this point yesterday, Aberdeen's one of the authorities that, all being well, we would hope would move down a level, but we don't yet have evidence of a sustained improvement and downward trajectory in Aberdeen, as is the case in many other parts of the country. And let me just try and explain why it's really important that we do have that kind of evidence before we take any part of the country down a level. Taking a part of the country down a level is not some kind of neutral act, or we've seen an improvement, therefore we can go down a level and nothing changes. Going down a level means an easing of restrictions. An easing of restrictions means that the virus has more opportunities to transmit, and we will probably see transmission increasing. And therefore, we've got to be certain before we increase the risks in that way that the particular area we're talking about, whether it's Aberdeen or anywhere else, is in a stable enough position to cope with that, and that it's not, marginal, so that any increase in transmission is immediately going to sort of tip it into the higher level again. So sustainability, making sure we've got a bit of comfort and headroom in the position of local authorities. And I would say to local authorities, all of them, including Aberdeen, who've been very constructive and I know have the best interests of their own areas at heart. It's not in the interests of any area to take it prematurely into a lower level, because what we risk doing then is allowing the virus to get out of control again. And that is not good for the people who might get the virus, those who might become ill or die from it, but it's not good for the economy either, because what it means is that we'll end up taking areas in and out of levels, which I can't guarantee we'll never have to do, but we want to try to avoid. So we've got to be really cautious and make sure that any area can cope with the implications of a lower level before we take them into it. And I would ask local authority leaders across the country, and I think most of them do, is to try and understand this. We're not taking decisions here just to keep local authorities in a higher level for the sake of it. We're trying to navigate our way through a global pandemic. We're not in complete lockdown nationwide like England is just now. Can't rule these things out forever. I've never said we could, but right now we're managing to stabilise things. As of now, might look different in a week's time, I don't know, but as of now we stabilise things through the targeted, proportionate approach that we're taking. We now need to make sure we can get things coming down the way, and so these are difficult decisions, but we make a big mistake if we decide to throw caution to the wind on this. And if there's lots of things we've learned over the past 7 months, but that's one of the things we should learn, is that this is an infectious virus, and if you give it the chance, it takes it. So we've got to be cautious in these decisions. Callum Clark from Bauer.
Good afternoon, First Minister. Another question on the tiers announcement from yesterday, if I may. Specifically in Angus, places like Montrose, there have been no new COVID cases there in the last 7 days. We've been speaking to one restaurant owner there who thinks the new rules just don't make sense, and it's been made on more of a Tayside approach. Now, I appreciate yourself and Professor Leitch outlined the rise in percentage cases there, but in terms of the overall view of what these decisions are being made on, is it on a health board basis as opposed to a council one, and if so, is there any point sticking with the current council model?
No, these decisions have been taken council by council, and I'd hoped that would be clear just now. Of course, there are some of the indicators that apply across health boards, because people in Angus, in terms of their reliance on Tayside, use the same IC youth facilities as other parts of Tayside. So, we have to look across health boards for some of these things, but these are decisions being taken on a local authority level. I really would ask people to understand, I don't want to be putting any local authority into any level of restrictions, and I don't want to be putting them into a higher level of restriction. But coming at this from saying, oh, there's no cases in Montrose, so therefore there's no problem and we shouldn't have restrictions. In the kind of situation Angus is in, I would, sort of politely suggest that is not the right way to look at it. When you've got cases rising in Angus, Angus is the 47% increase, 47% in the space of the last 7 days. Cases across Angus have increased by 47%. That is rapid and sharp increase. If we do nothing about that, it may be the case that there's no cases of COVID in Montrose today. I'm pretty certain that will not still be the case this time next week. So this is actually about trying to make sure that we prevent that rapid increase we're seeing across Angus causing more cases and the virus ending up in areas, if that's true of Montrose, where it isn't just now. So this is partly preventative so that we don't wait a week and then cases have risen by another 50% in Angus and it's much, much worse, and we're trying to get a much worse situation under control. So I would ask people, I know these decisions are difficult, but none of us are doing this for the sake of it. None of us are taking decisions to put restrictions on local authorities for no reason. And we're publishing all of the data that is driving these decisions. I appreciate that because, and I think this is inevitable and important, that we don't just do it as an algorithm, we apply judgment to the data. So I appreciate that that's the bit that can often be difficult for people to grasp, but the data's there. If you live in Angus, you can go on and look at the rising cases, the test positivity, and what we're doing right now is trying to stop that getting worse, so that Montrose, which if it is case-free right now, might have a chance of still being case-free in a week or two's time. Do you want to add anything on?
Only I've got all of the local authority data here that people can look at, and I would ask you to do that. But bear in mind, it's not. If you reach this number, you go up or down. We have to take into account in our advice and then in the decision making, the geography, the nature of the demographic of that local authority. But Angus has gone from 48 cases on the 28th of October to 78 cases on... Yes, per 100,000 on the 6th of November. We had our numbers in the data I described in 2 months ago. It was lower than that for the whole country and lower the month before. The trajectory, unfortunately, in Angus is upwards. And to the previous questioner, Aberdeen and Highland are not the same. You have to have a range within each category. Of course you do. There will always be low and high within that range. But Aberdeen City, on that same measure, has gone 47, 43, 44, 35, 35. Highland is 25, 22, 25, 25. So they're not the same. And it's important that people try and understand this data as much as they can, but then also layer on top of it the nature of that geography, the travel in and out of it, the travel within it, and the ICU and the hospital capacity within it.
Anas Hassan from Kingdom.
Good afternoon, First Minister, and good afternoon to you as well, Professor Leitch. I'd like a response from both of you to my question today, please, if that's okay. We've had 2 separate outbreaks in Fife this month, one linked to a hospital ward and the other a care home, accounting for more than 60 cases between them. We've also had a small number among students, some of which have come from outside the Kingdom. To what extent have these cases been a factor in the rising infection rates in Fife? And what evidence is there around the level of transmission taking place in the wider community in particular?
It is likely that the outbreaks are having an impact, but one of the things we look at, and you will have heard way back me saying similar things, is can we be sure in any area that if there is an outbreak or a couple of outbreaks that it is contained within these, or has it seeped out into community transmission? And I think in Fife, yes, outbreaks will have an impact, but there is no confidence that we don't also have wider community transmission. This virus spreads very fast and very effectively. It's a highly infectious virus, and therefore we can't always just hang around to see if things might be okay. We have to be prepared to act to get ahead of it, and that's what we're trying to do with the application of these levels. But I'll ask Jason to expand on that.
Only briefly, you've covered the answer. It is, of course, partly outbreaks, but partly community transmission. One of the key conversations in the weekly review is with the Director of Public Health responsible for that local authority. So the Health Board Director of Public Health for Fife is involved in those conversations, feeding into the National Incident Management Team and then feeding in to Gregor and Fiona and I. And that conversation is one of the most crucial, because if that Director of Public Health says we're worried about this or worried about that, or we're not so worried, so in the islands, the change to the in-home socialising supported by the Directors of Public Health. That's crucial for me to be able to then feed that advice upwards, because I'm not on the ground as a Director of Public Health. So in Fife, that Director of Public Health is concerned that there is community transmission beyond those outbreaks. And those outbreaks tend to follow the community transmission around the country.
Katrine Bussey from PA.
Hello, First Minister. I wanted to ask today about an announcement from the government this morning that over 1,000 new teachers and support staff have been recruited for schools to help them build resilience during the coronavirus pandemic. And it's really just quite a simple question. What will happen to these teachers and support jobs when the pandemic is over and we go back to some degree of normality? Will they still have their jobs in the classrooms?
Well, we don't think building resilience and supporting schools through the pandemic will just end. I don't know, Jason might be able to say this, that we will get to a point where there's a declaration anytime soon that the pandemic is over. We're going to need this extra resilience and all of the support that schools will need to catch up on lost time early in the year for some time. So we want to continue students that obviously I can't preempt budgetary decisions next year or the year after that, but we want these teachers to be available in our schools on an ongoing basis. So these are teachers that are being recruited for the longer term task of not just getting through the pandemic in the strict sense, but making sure that we get through the implications and the consequences of the pandemic for the future too.
Yeah, we're going to have to learn to live with this virus endemically, just as we've lived with it pandemically just now. And we are not at that transition point even. There's been a lot of excitement, quite rightly, this week about vaccine, but that's not going to be sudden. That's going to take a long time to feed through into the population to get us the level of protection that we need to even get back to some form of normality. And unless the virus changes in a good way, then we're going to have to learn to live with this virus in some way for the foreseeable future, just like we live with the influenza virus.
Chris Musson from The Sun.
Hi, First Minister. Just two things quickly. Firstly, on Test and Protect. Back in May, you said the aim of Test and Protect is to protect the public from spreading COVID-19 and to protect the country from a second peak. Obviously, we're now at a second peak. So on your own measure, has Test and Protect failed? And secondly, on hospital-acquired COVID, new figures which you'll be aware of, which are just out from Public Health Scotland in the last hour, show a further 63 definite hospital onset cases of COVID. That is for the weekend in October the 18th. So that makes 152 cases since the start of September to mid-October of people who have definitely caught COVID in hospital. There's a 3-week lag on this data, as you know. So are we anywhere near getting this situation under control in hospitals? And are you aware of any deaths as a result of hospital onset COVID in this second wave? How many have there been? Presumably there are provisional figures that ministers are privy to.
I don't have that latter piece of information that I'm able to answer that question. I will come back on that particular question. What I would say, and I think everybody understands this, is it often takes a lot of scientific work to make a direct connection between where somebody having the virus and where they got the virus, and then of course if they have died, connecting all of that up. But of course we do a lot of work on this in order that we can publish figures that are as full and comprehensive as possible. And the figures we publish on nosocomial infection, the ones that have been published by Public Health Scotland this morning, they're published every week, and we do that so that we do develop that deep understanding. The other point I would make on hospital-acquired infection, and it's we work very hard, and I say we, those in the front line of our health service, supported by government and clinical advisors, work very hard to minimise as far as possible the transmission of any infection in hospital. It's one of the things I most vividly remember about my time as Health Secretary. Back then, of course, the big challenge the Health Service faced was C. difficile, and all of the work to reduce that and to bring cases of hospital-acquired infection as low as possible. We're clearly now doing that with COVID. I'm not sure, although I'll hand over to Jason, who can give an expert view on this. I'm not sure it's ever possible to say that you eradicate completely the possibilities of infections being passed in hospitals, but the absolute responsibility is to reduce that as much as possible. And the figures that you have quoted, I don't have the report in front of me. I was reading it earlier on this morning, and I'm not saying this to minimise them at all, because I don't think that would be right or appropriate. These are serious issues. But the figures you've quoted are, and as I say, I don't mean this to sound as if I'm trying to excuse them or say that this is any comfort to anybody who's got COVID in a hospital, but they're a very, very small percentage, I think a fraction of 1% of the total cases that we see. So I think that's just a bit of context, but it doesn't take away from the importance of making sure that hospital-acquired infection, of any infection, but we're talking about COVID right now, is minimised. On your first question, emphatically no. Test and Protect is working. It's working well. I've quoted a number of statistics already, which I'm not going to repeat. This is also information that is published weekly by Public Health Scotland. But as I've also said, and you could probably paper your walls with quotes to this effect from me as well, Test and Protect is our second line of defence. Our first line of defence is all of us. It's part of an overall approach to controlling and suppressing the virus. It's doing a good job. Right now, and I say this in the full knowledge that, this could look very different this time next week, but right now, compared to other parts of the UK, compared to many other countries that are also going through the second wave right now, Scotland, relatively speaking, is doing, I hesitate to say well, because I don't think it's the right term in a situation like this, but we've flattened the curve. We need to get it down, and Test and Protect is part of the way in which we are doing that. So the people working across Test and Protect deserve our gratitude. They have my gratitude, and we will continue to make sure they are supported to do the job that they do. But I'll hand over to Jason on one or both of these points.
So it's hugely difficult, Chris, to get completely COVID-free institutions unless you isolate all of the staff at every single level away from their families. Last week was the European Healthcare Quality Conference. Should have been in Copenhagen, but it wasn't. It was online. And one of the things that conference dealt with was healthcare-associated infection in relation to COVID, because that community globally, and Scotland has been at the forefront of that, has been about reducing hospital-acquired infections for years now. And we've done a remarkably good job, but now we have a new infectious agent. And if it is in the community, it is so difficult not to have a few cases that come in, even with PPE and staff really following the guidance as tightly as they possibly can. It's hard to get completely COVID-free. So therefore, we have to just keep trying with the communication, with the PPE, with the guidance for staff and for visitors, although the visitors are limited, and for how you behave if you're a patient or a carer coming into that institution, and how you wash your hands, how you should isolate, follow the instructions that you're given before you come. And we will do everything we can as we learn from around the world about how to get that better and better.
Derek Keeley from the Courier.
Derek Keeley. I asked him my question. I asked him my question if you think that the situation now is back under control in hospitals, because there's a 3-week lag on the data, and the data that we're seeing to mid-October shows definite hospital onset cases going up. So have you got any indication?
I don't, no.
As of now?
I don't. And the reason there's a 3-week lag on this data, which is longer than the lag on some of our data, is because of the work that has to be done to determine. So this report, you read it, but for those who don't know, it classifies hospital-acquired infection as definite hospital-acquired infection, probable, I think I'm using the right terms here, probable hospital-acquired infection and indeterminate hospital-acquired infection. And the reason it uses those terms, and the reason it takes a bit of time to put cases into these categories, is there is a lot of work to try to determine. If you're a patient in hospital with COVID, it's not possible immediately to answer the question, did you get COVID in hospital? Did you contract the virus in hospital, or were you incubating it when you came into the hospital and you just started to display symptoms when you were in hospital? So that actually takes, and I don't understand the processes that are gone through, but that takes a bit of time to answer these questions to the extent that data can be published in a reliable and robust fashion. So in this case, that is why there is that 3-week lag in the data. Derek Keeley from the Courier.
Thank you, First Minister. I wanted to ask you about treatment for long COVID, just following on from your point earlier. When I first asked about long COVID at a daily briefing back in July, the Health Secretary acknowledged that services for longer term conditions would be needed beyond just a kind of standard rehab. We're more than 5 months later, and of course some people have been issues since March. So can you say when you expect those services, including perhaps dedicated clinics, to be available, and what's been behind the sort of delay so far?
There's not a delay. This is a new virus, and so firstly, can I say, I think long COVID is one of the most important implications of this virus that we have to deal with now and will potentially be dealing with for some time to come. But we don't yet, and I'm going to hand over to Jason for a clinical explanation of what I'm about to say in a layman's sense. We don't yet know what causes long COVID. We don't yet know what all of the precise symptoms are. So in terms of setting up a specialist facility, I'm not sure it can be answered definitively. It's exactly what kind of specialisms are needed to best treat long COVID, because we don't understand it yet. And this is a virus, remember, that has existed for less than a year. So talking about delays when we are still, the scientific community is still trying to understand these things, I don't think is entirely fair, to be frank about it. And that's why we are doing the work we're doing. So the £5 million investment that I spoke about, that is funding 56 rapid research projects, which are being undertaken at different Scottish research institutions to try to give us a deeper understanding so that we know what kind of facilities we're actually then going to need to create to deal with this. If you don't understand it first, you might create a specialist clinic and call it a specialist clinic, but what if it's not actually providing the specialisms that people who have this aspect of the illness need? So that work is ongoing. And we will continue to pursue it as rapidly as possible. And in the meantime, of course, the health service does have to care for, treat, give advice to people living with what, of all of the accounts I have read, is a horrendously debilitating condition. They have to do that as best as possible. But the most important thing we can do is get that understanding so that the services we provide in the future are actually the services that people in this category are going to need, not just now, but potentially, we don't know, for quite some time to come.
This is a new disease. It's a brand new disease. Nobody had it 11 months ago. So we need 3 things. We need research to understand it. We need guidance for the clinical teams who will treat it. And then at the high end, we will probably need specialist clinics for some people. But who would you like to staff that? Do you wish an endocrinologist? Do you want an immunologist? Do you want an intensive care doctor? Do you want a general practitioner? Nobody knows, because we don't know what the disease is yet. We know it's a complex syndrome of a lot of symptoms. And therefore, just now, it's being treated by generalists, general physicians in hospital, and GPs in the community, along with their clinical teams. So we have to do the research, then we have to do the guidance, which we're writing just now, with SIGN, our version of guidance, NICE, the English and Welsh version of guidance, and the Royal College of General Practitioners. That will need updated all the time as we learn more and more and more. And I would not be at all surprised if at the high end of that, there are some very sick people who may need hospital specialist clinics. But just now, we don't know what kind of service they require. So our rehabilitation people, our primary care people, and our secondary care people are working together to get to that end point.
Michael Blackley from the Mail.
Thank you. Good afternoon. I've just got a few questions regarding the upcoming COVID immunisation programme. Can you confirm exactly what your latest estimates are, the up-to-date estimates of the number of doses of the new vaccine that you might have? And in Scotland, we have 1 million people who are of pension age and might see themselves as being one of the priority groups. Have you got any estimate at this stage as to how long it might take to get through that for them to all be immunised? And just finally, in terms of mass immunisation centres, will there be GPs and other frontline NHS workers that need to be diverted towards those? Will they be staffing these centres? Thanks.
No, I can't give you definitive answers to all of that today because we don't yet have the information that would allow me to do so. I addressed some of it in Parliament yesterday. We don't know exactly how much vaccine we'll have over what timescales. We have estimates of that. We are basing planning on the best assumptions. We know of the Pfizer vaccine, which is not the only vaccine in play. There are others undergoing trials just now. That the UK as a whole has 40 million doses of this, and Scotland will get a population share of that. We understand that vaccine will require to be administered in 2 doses per person, 3 weeks apart. But until we, absolutely know what the delivery schedules of that are, we can't be definitive about some of these other questions. But we will continue to set out our plans. There is a huge amount of planning underway to make sure that whatever the delivery schedule is, then we are in the position to roll that out and get people vaccinated as quickly as possible. This is going to be a massive exercise, clearly, and so yes, there will be NHS staff undoubtedly involved in that, but as we finalise more of the details of this, we will share them in the normal ways. Do you want to? No. Okay. Tom Martin from the Express.
Hi, thank you, First Minister. Just a brief follow-up on the earlier questions regarding the situation with this apparent instruction to teachers in Aberdeen to turn off the Protect Scotland app. There are some reports that this may have happened elsewhere. Is the government aware of that? And if so, or is there any concern that safety may have been compromised as a result?
I'm not aware of that, which is not the same thing as saying it's not happening, because I'm not aware of it. I try to be as aware of as much as I can, but I can't be aware of absolutely everything all of the time. People shouldn't turn off the Protect Scotland app. Jason's outlined circumstances in which if you're wearing PPE in a clinical setting, you might do that. If you're behind a plastic sort of barrier, it may be okay to do that. If you're putting your phone in a locker at work so you're not with your phone, it might be okay to do that. But I would encourage people, wherever possible, if you've got the app in your phone, keep your phone with you and keep it turned on. So, I've heard some suggestion that Aberdeen City Council have given that advice to teachers on public health advice. I don't yet know what that is. I'm not a public health expert, but using common sense, if you've got an app on the phone that is meant to assist with contact tracing people who might have been exposed to the virus, your default advice is to tell people to keep it on and to keep the phone with them as far as possible. David Ball from the Herald.
Thank you, First Minister. Following on from that, the letter sent out in Aberdeen to staff indicates that the issue has been raised at a national level. I was just wondering if that is the case, and does this sort of advice undermine the importance of the app as sort of another layer of protection when the advice being issued is essentially saying it is a substitution for mitigation already being in place?
Look, I have only become aware of this morning, so I can't say for sure what the chain of advice that might have led to this letter, and I've not actually seen the letter, so I'll caveat my answer in all of this. But let me be very clear: the Protect Scotland app only works and is only effective if A, you download it to your phone, you keep it switched on, and you have your phone with you. If it's on and running when your phone is away from you, it may still get alerts, but obviously that will not mean you've been close to somebody with the virus. So keep your phone with you, keep the app on, and keep Protect Scotland on your phone. I don't know at the moment what the basis for Aberdeen City Council's advice is. As you hear often, they question national advice quite liberally and quite often, as they are absolutely entitled to do. So I'm not entirely sure what the chain of events leading to this will be. I will certainly be trying to get to the bottom of it later, but I cannot be clearer. If you're a teacher in a school there's no reason that I could think of that you would be routinely advised to turn that app off. And there's every reason I can think of why that would be not the right advice to give. So I'll be clear about that. And if there's any issues we need to clear up about how advice can be given that doesn't seem to me to be right, then we will do that. Helen Puttett from The Times.
Thank you. There's understandably been a focus on universities and students going home for Christmas. I wondered if I could ask you both about the school Christmas holidays. We've looked through the holiday dates, and 21 local authorities break up on either the 22nd or the 23rd of December, so very close to Christmas Day. Can you tell us, is this safe? And also, can you tell us if any of the groups in Scotland are looking at those dates and reconsidering them? Thanks.
We'll continue to consider these things on an ongoing basis. There are no plans at the moment to change the school holidays. I think before I could answer the question, I'll hand over to Jason about safety. You would have to kind of tell me why you think that is not safe. I mean, presumably you're talking about people visiting family members or whatever, but we will obviously have guidance in place generally, which we have just now in terms of household interaction, where we're asking people not to do it. If that has changed for Christmas, which we all hope to some extent it will have, although we can't guarantee that, then we will give people clear guidance.
I would only add the big difference between school pupils and college students is they're in the one household. That's not true of every child in the whole country. Some have more than one household. But in the main, they're going back over Christmas to where they've been over weekends and in the evenings previously. So that doesn't worry us as much as further and higher education. And I'm also hopeful with the First Minister that if we drive the numbers down over the next, what's now 6 or 7 weeks, then the household restrictions will be able to have some kind of relaxation over that period. So that, again, will have to be taken into account about those exit days from school.
Thanks. Gina Davidson from The Scotsman. No, Gina Davidson. Daniel Sanderson from The Telegraph.
Thanks very much, First Minister. In the summer, you and John Swinney said when you announced that the schools would be going back that there would be surveillance testing of asymptomatic children and teachers in schools. I just checked with the government recently what was happening with that, and they said the feasibility and acceptability of tested all the school children was still being assessed. So I was just hoping you could give us an update on this. Is it something that you're still hoping will happen, or have those plans been ditched? And also just looking at the figures from Public Health Scotland, there were nearly 2,000 school-aged children, so 5 to 17-year-olds, who tested positive in October, and a further 769 in the first week of this month. So given we don't seem to have the asymptomatic testing, and we know that school kids don't necessarily display symptoms as much as other people, how can you be sure that this isn't a significant? They're just a sort of tip of the iceberg, and this isn't a significant factor in driving the infections we're seeing in the wider community. And also, it'd be great if Professor Leitch could just say a bit about: are you aware of the increase in positive tests among school children? Is it something you're concerned about? Thanks.
I'll hand over to Jason in a second. I don't have the update around surveillance tests in front of me. We'll get that to you later on. There is testing, so any member of school staff, if they fear they've been exposed to the virus, can get tested. There's also been an initiative around antibody surveillance testing, I think, within schools. And we do surveillance testing more generally, but I'll get you an update later on exactly the position in terms of schools. In terms of the figures with young people, I'll hand over to Jason on this. Young people do get this virus. They are much less likely to become ill with this virus, although the chances of that are not zero. We must be careful that we don't make an assumption that young people getting the virus have got it in school. The evidence suggests that transmission within schools is actually very low, but young people go other places and mix with other people. And the numbers of young people in school age groups, certainly, and I don't again have the figures right in front of me, but will in absolute terms be the kind of big numbers that you have quoted there, but actually as a proportion of overall infections will be less than will be a small proportion. In terms of asymptomatic testing, we have never said that positive tests are the whole story. We always make the point, and all of our modelling takes account of the fact that for whatever reason there will be people with COVID that aren't tested. That may be because they don't have symptoms. It may, although I hope this is not in many cases, because we constantly tell people the importance of getting tested if you have symptoms, but it may be that somebody has symptoms and doesn't go for a test. So we always have to assume that the confirmed positive cases is an underestimate, and always will be an underestimate of the total infection. So every week when we publish the R number, we also publish assumptions for how many people in total will have the virus in any given week, and those are the figures that lead into our wider modelling. I'm not going to go through all of the arguments again about asymptomatic testing. We are doing much more asymptomatic testing. We will continue to expand that, but let's always remember that testing is really important, which is why we put so much effort into expanding the groups and the different technologies we use, but it is not the only thing that we've got to do, and there are limitations to what a test tells you, which is why we've always got to do all of these other things as well.
I was looking for the age breakdown, Daniel, but I either can't find it or don't have it. It is available. I would expect that to be quite low proportionately to the overall numbers we're seeing across the country. I would also expect it to be 5 to 17 is quite a large bracket, and as you know, we've introduced face coverings for the older children, the older young people. So that's the group we are more concerned about, and infections in that group behaving a little bit more like adults. So we're not complacent about transmission in schools or in young people outside schools, two different things. And we're very, very keen that young people follow the guidance for them, just like the rest of the population. However, the public health advice is shrouded by the fact that schools are so important for public health. They're important for feeding some children, they're important for clothing even some children, and they're important for education and well-being around kids going to those institutions. So you have to take that into account when you give advice about what you should do about COVID inside those institutions. So they're absolutely crucial to our society.
You can, as Daniel has quoted there, you can go on to the Public Health Scotland website and see the age breakdown amongst younger people. So the under 17s age group is broken down into different age brackets. Neither of us have the figures in front of us just now. I was reading them last night, and they are published and updated every week. So if you're interested in seeing what that is, you can go and look at it. That concludes the questions today. So thanks to all the journalists for joining us. My thanks to Yvonne for the BSL interpretation, to Jason for helping me answer the questions, and to you for joining us. I will join you tomorrow from the Scottish Parliament for the update and the weekly session of First Minister's Questions. That starts at 12:20 on a Thursday. I hope you can join us. In the meantime, please stick with all the guidance in your area. Make sure you know what the rules are in your area, and remember to follow all of the facts advice. This regional approach we're taking is intended to be more proportionate, so that people living in the islands or the highlands with lower prevalence don't have to live under the same restrictions as people living in Glasgow with much higher prevalence. But it only works if we all abide by it, and if we all abide particularly by the travel restrictions that go with it. So please continue to do that. Thanks for joining us today, and I will see you from the Scottish Parliament tomorrow, and be back here with you at 12:15 on Friday. Thank you.